Before we get started with the show, I definitely wanted to just preview this before we talk to Eric and George. And what they've done a really great job of is showing you how a great match happens in the first place. And in part of the show, Eric reveals how he kind of came up with those things that he really wanted in a residency and how those were going to propel him afterwards. While everything doesn't have to be concrete, it's so clear how this is a great match. And a great match after you do match to a residency is like an ending of a great book where, oh man, that's how it had to happen all along. And although you didn't know it at the time while you were reading the book, in hindsight, it absolutely fits. And in the same way, you're going to see how Eric's energy and innovation and desire to be an entrepreneur perfectly fits with this residency site. And you're going to see not only some great tips in getting a residency in the first place, but also what it's like to be in a residency where you're allowed to innovate within, of course, the ASHP guidelines, but you're allowed to innovate and really be yourself so that the next step is as equally impactful as the first. So again, if you need help with your residency letter of intent, email me at tonythepharmacist@gmail.com, or just sign up for the course and then give me an email and let me know where you are in the process, and I'll take it from there. You can find the course at residency.teachable.com/letter P/extreme LOI. Let's get on with the show.
Welcome to an episode of the Pharmacy Residency Podcast. My name is George Shi. I'm a P4 student at the University of Iowa, currently on rotations. And with me, I have Eric Mueller, if you want to go ahead and introduce yourself as well.
Yeah. Hey, everybody. My name is Eric Mueller. I am a PGY1 community resident at Towncrest Pharmacy in Iowa City. I'm originally from the state of Minnesota, where I grew up and went to undergrad. And I actually attended the College of Pharmacy of the University of Oklahoma to get my PharmD. And from there, I pursued a community residency and landed back in the Midwest.
Oh, nice. Nice to know. I probably should have mentioned I'm from the University of Iowa, pretty much grew up in Cedar Rapids, went to the University of Iowa for undergrad, and as well went to the University of Iowa for College of Pharmacy. And as of recently, I have been looking into going into community residency. And I was just wondering, do you think it's maybe too late to start preparing for that, or what are your thoughts?
Well, George, it's November 4th, 2020. I don't think it's too late at all. I will tell you, I didn't even think about residency until I started my P4 year. And at OU, we do 9 4-week cycles. So June 1st was my first rotation site, and it was at an independent community pharmacy in Edmond, Oklahoma, which is just north of Oklahoma City, which is where the College of Pharmacy is at. And it was at that site that I realized I wanted to do a residency. So from June, I had that idea, but I didn't actually really begin the formal application process until probably about this time. So I don't think it's too late by any means.
Okay, and if you don't mind me asking, how were your grades? Like, I can't say mine were super stellar, but they're, average middle of the pack. Is that going to be like a super hindering factor, you think, of preparing for that? Because, again, I was never really preparing to do a residency, so I always wanted to do just like generic community, like a standard. But going on rotations, I've really opened up my mind a lot more to just branching out from what I'm used to. And so I was just wondering, yeah.
Yeah, I mean, grades are definitely an important piece, but it definitely doesn't tell the whole story. I know that, let me just give you an example. Coming into pharmacy school from my undergrad, I had probably right around a 3.0, which for applying to pharmacy school, like, I don't know what your thoughts are there, but is on the low end as far as what you could be applying with. So I was, hoping to get in somewhere, and obviously I got into OU, but when I was in pharmacy school, I kind of ramped that up. So just to give you a number, like I was right around 3.5 graduating.
Okay.
But I don't think that, a 2.0 would be a C average. I don't know if you'd want to be that low, but at the same time, that's only one piece of your application. So the grades are one piece. The interviews, I mean, right now I know we're dealing with the virtual thing, but
Yeah.
when you get that face-to-face interaction or, Zoom face-to-face interaction, when you really get to know that person, that's going to mean a lot more, in my opinion, than the GPA.
Okay. And to, I guess, go off of that one, were you involved in any organizations, like pharmacy organizations, student orgs, like any leadership stuff?
Yeah. Yeah. I was heavily involved in NCPA, so the National Community Pharmacists Association. I was involved with OPHA, which is Oklahoma's Pharmacist Association.
Okay.
So those are kind of the two main ones for me. I was also a College of Pharmacy ambassador, which basically recruitment was a big piece of that, helping with interview days and whatnot was that. I was also a member of Phi Delta Chi, and I served as the historian for one term there. I think it was P3 year for me. But yeah, so I was pretty heavily involved with the organizations that lined up with where my postgraduate plans were, which community was kind of always where that fit.
Yeah. And I can't say that it's super recent, but like I would say like P2 for me is when I first started thinking about community residency. And so I was talking to a couple of my classmates about it, and they seem to kind of think that like, what's the point if you can just go straight into community pharmacy, just like working at a standard community pharmacy rather than doing community residency? And what do you think that community residency can offer you compared to just going straight into community pharmacy?
Yeah, that's a really good question. And that is something that should really be thought hard about. I think probably the main benefit of doing a residency versus just jumping right into either a chain or independent would be just the level of practice that you are training yourself in immediately. So you may have heard a residency is sometimes described as 3 years of practice in one, as far as a PGY1. So really training as a very high level practitioner coming out of the gates, I think really sets you apart. And I also think that, especially in the independent side from an employer standpoint, they're looking for residency trained pharmacists going forward primarily. And I know the job market, some people think it's tighter than it is, but at the same time, to make yourself stand out, I think they're really looking for a residency going forward, especially independent wise.
Okay. Yeah, that's really good to know. I was, as you could tell, just kind of curious because that kind of, as talking to them, it kind of turned me from community residency for a bit. But now that I'm back in my P4 year and I see a lot of just opportunities for it, it's come back into my thought process, and I just kind of wanted to see what you thought about just comparably, because again, I've only ever technically worked retail and haven't really thought about anything else until recently. I guess another question that I did have was, what is kind of like a typical day in like a community pharmacy, or do you kind of do the same thing each day, or does it rotate day to day? Or I guess I wasn't completely sure what you would do in a community residency compared to, again, just a community pharmacy.
Yeah. So one of the really unique things about the pharmacy I'm at is it's separated. Basically, you can think of it as you have the dispensing side of the pharmacy and the clinical side of the pharmacy, the clinical services. So the resident, I am housed in the clinical side. So I work directly with our clinical program director, who's a pharmacist. And my typical day, so the hours, I'm there at 9 a.m. to 6 p.m. And a typical day for me would be consistent of medication therapy reviews. So you can schedule those, I can schedule those myself. So I can kind of plan that, but utilizing the MedSync program. So I'm calling patients on MedSync medications to ensure there's no changes and letting them know things are ready. This time of year, we just kind of got over the flu clinic season. So that,
Okay.
as far as day to day will change a lot during the fall, going to local businesses to give them their flu vaccines. We do offer diabetic shoe fitting as well as compression stocking fitting, as an enhanced service outside of dispensing. So yeah, typical day, to be honest, if you have community pharmacy experience, but you have only been at one location, maybe it was a corporate chain or maybe it was an independent, I really think going into a residency, you would learn a lot, even in just the first few weeks, as far as how different that is, especially when talking about the Iowa sites that I know. how they practice pharmacy is much different than the corporate retail area.
Okay. And did you always want to do like, I know some of the larger chains also offer a community residency, but did you always want to go to like an independent pharmacy like residency, or did you ever plan to like go to a corporate one?
My experience, my early days as a pharmacy technician in Minnesota was at Walgreens. And I transitioned into an intern position when I started pharmacy school in Oklahoma. And I was also employed by Sam's Club. So I've had a lot of corporate chain experience. Independent really stuck out to me as a way to really learn from the business standpoint where you can really create change. I feel like for me, I was thinking if PG1 wanted a corporate, I might not have as much pull as far as doing something I want to do to either benefit myself or the practice. But yeah, I think that having that background has really led me into realizing that I wanted to do a PGY1 in independent to have that change.
Okay. And in terms of guiding your education, so is it more regimented, like they have set out what you do each day, or do you also kind of suggest like, hey, this is kind of what I want to learn throughout this residency? Or I guess how does the education kind of go? Like, do they have a set list of clinical services they need you to complete, or?
Yeah, so I mean, there are regular daily responsibilities that the resident is tasked with. Medication reviews are one of those things that is a revenue generating source for the pharmacy. So that's a pretty high priority for you to get those done as a task. But as far as individually tailoring it, that is definitely something that I'm very passionate about and was very upfront about coming in, like to want to make it so that I'm progressing towards my overall career goals, which might surprise some, but I have really high aspirations to create a healthcare business, angling it, looking at technology right now. I mean, I'm trying to utilize my PharmD in a very non-traditional way, but by doing a residency at the community level, especially in an independent side, I really feel like you're able to learn about the business side of it in a much more open way. Sometimes I feel like within corporate, there's a lot more hoops to jump through, and I've experienced only Walgreens and Sam's Club, but so I can only speak to that. But as far as I know, there aren't programs that really would give you as much freedom to do it. You would have a larger scale of stores, but to be able to have that impact, I feel like be a little bit limited.
Okay, yeah, that makes sense. And when you said you were upfront about it, how early in the application process did you ask about it? Because I guess I was thinking if I do apply and I do want to tailor it to my own goals, I don't want to like ask too late and they're like, oh, well, you can't back out now, or I don't want to ask it too early, where I guess I don't know that it would affect your chances of getting a residency at all, but.
Yeah. I mean, I could say just to clarify, so being upfront, very early on in the residency, right? Like within the first few weeks, we have a meeting. I'm pretty sure all sites would do this, at least all the community Iowa sites. I'm speaking as far as sites in the nation too, but you have a meeting with your preceptors at your site along with your residency program director and set out your goals and expectations for the residency. So, right, just wanted to be very open as far as what my expectations are for my personal growth, without wanting to, hinder the tasks that are required of the resident to, help you learn in that way. But there are set requirements through ASHP that you're forced to, well, forced isn't a great word for it, but you are required to meet. So direct patient care for community residency, I think is 50 or 60% of your time. But I looked at that as a way I could use that and kind of lead that into my business mind itself and use my patient, care opportunities to think about what is a new service that I could implement, or what is a different angle of looking at this from an innovative standpoint.
Okay. And I guess going off of that, back to, I guess, the beginning and more background, when/how did you when did you want to be a pharmacist, and how did you kind of really know that this was the career for you?
Yeah. So when I was in high school and even earlier before that, I always knew that I wanted to do something within healthcare. And for the longest time, I thought that I was medical doctor, trying to go to med school. And I can't explain for sure, George, but when I was a freshman at undergrad, I just felt that was not the right decision to try to pursue that pre-med route. And I had an advisor at the time who, his wife was a pharmacist, and he was one of the chemistry professors at St. Olaf College, which is where I went to school. And he suggested I look into that. And that's what led me into a student internship with Walgreens in my college town of Northfield, Minnesota. And so that was kind of how that seed was planted. And by experiencing community pharmacy at Walgreens, I really enjoyed the personal aspect to build connections and relationships with the patients. So that's kind of where that passion to be a pharmacist started.
And did you always want to kind of do something non-traditional with your degree, or did that come out sometime during like school or later on in your career, like even during your residency?
Yeah, I would say a little bit of both. I would say later on in school and the beginning of the residency, I really, started to realize what my career goals were going forward post-residency. And just as a piece of advice, I've been using LinkedIn a lot to network. I think that's a really important piece of it if you just want to advance in any way for your career. But yeah, it kind of started right kind of at the change point of graduation and beginning residency, where I really started to get a clear view in my mind as far as what I wanted to do post-residency.
Okay, and going back to the residency application process, do you have any advice for like preparing / for the interviews, like preparing your application?
Yeah, the application. So the Forecast portal, which I think just opened recently here in November, but so that has a lot of kind of just fill in the section as far as what your demographics and whatnot. But probably the most important components of the application are your letters of intent and your letters of recommendation. So I think probably some advice that I would have is reach out early to those people that you want to have write letters of recommendation for you, so that they have plenty of time to do that. So if you know that your program deadline is late December, like you should really give them at least 3 or so weeks to write that letter. And even then, I would say you probably should just request it like a month and a half in advance, assuming that maybe you would say, I haven't met that preceptor yet or something, but the earlier the better on that. And then your letters of intent, which is probably the biggest component of your application, which is just, a written letter explaining your interest in the program and what you can bring to it and what it can bring to you. And I utilized some internet, forums to kind of tease out what people look for, and reached out to the program directors to just ask them what makes a good letter of intent in their mind. So yeah, I think just being proactive about it. Like if you were, thinking about applying, for a residency that the program closed in December, I'd probably say, just get the ball rolling in the next few weeks or so. And there's still plenty of time, not to scare you, but yeah. Just the earlier the better.
Yeah, as with everything. That's really good to know, because I had previous to wanting to apply for residency, I had never really thought about a letter of intent or even realized what it was until I guess my rotation with Dr. Guerra, which he does offer a letter of intent like overview. But yeah, that's really good to know. And how was the interview? Was that any different from any standard like job interview, do you think? Or was it kind of just like a more standardized interview where you just show them your skills, explain what you do, explain why you want to be there, anything of that sort, really?
Yeah, so the interview for the site that I matched with, Towncrest Pharmacy, so I interviewed with the current resident, and then I interviewed with 2 of the co-owners of the pharmacy. And one of which was, and this was pre-COVID, but one of the interviews with one of the owners was via Zoom or FaceTime on an iPad. So that was a little bit non-traditional, but it also was like, I just viewed it as an opportunity to just, I'm flexible, I'm ready to do whatever, as far as connecting with people and whatnot. But as far as the questions and whatnot, I think it was pretty standard as far as what you would expect them to ask. Okay. And I tried to make sure that my answers were definitely, aligned with what my letter of intent was, because I wanted to make sure that, it was that I felt those words that I wrote. They don't like cookie cutter responses. So I think one piece of advice for you to think about if you're thinking about residency is that
Yeah.
They might ask you to just tell you a little bit about yourself. And I wrote my little, you could call it a 30 to 60-second elevator pitch about myself while I was on a plane, just on my phone in the notes section. And I just kind of started writing it. And I was like, yeah, I'm glad I'm getting this down on, virtual paper, because it at least gave me a template to kind of look at. And I don't want to say I memorized it word for word, but it sounded genuine. So if you could try to find a way to get a genuine sounding 30-second elevator pitch about yourself, I think you have a leg up on most people, because I don't think everyone does that.
Okay, yeah, that's good to know. We also have University of Iowa interviews coming up soon, and I hadn't thought about that, so that's really good advice, or that's really good to know, because I also would have been one of the people that did not prepare that. But would you? I was also going to ask for. I know ASHP mid-year that's where a lot of people go to get their residency interviews. Did you also have to do that for a community residency, or was it through something else? Or I guess I wasn't completely sure how you went ahead, and I kind of know the process of going through like the clinical residencies, but I guess I'm not too familiar with the community ones. Is it kind of the same deal?
Yeah. So this might surprise you. So I didn't go to mid-year.
Oh,
I didn't attend mid-year. So the way I viewed it, and this won't apply to everybody, but I attended a conference in Overland Park, Kansas in July of my P4 year. So my second rotation cycle, which we do 4-week cycles there. And at that conference, I met some people, really deeply rooted within community as far as the national network. And I had built kind of a regional network in Oklahoma. So I viewed it as I've already at least connected with most of the people that I feel like I would have reached out to at mid-year. I did go to NCPA annual convention and chat with a lot of the community residents there. I chatted with the resident that was at my site before me at NCPA. So I think some convention involvement is definitely important. If you're thinking community, NCPA really is like a really great place to go. I know the, more hospital-based PGY ones, mid-year is like pretty much have to go, I feel like, unless you have a relationship with the RPD beforehand. But yeah, I didn't actually go there. So that's kind of one unique thing. But
yeah, that is really neat. I would have never guessed. And back to what you were, I guess, doing at your community residency, has COVID really changed much about your residency? Do you feel like, is it harder to meet with patients? I mean, obviously there's social distancing and the standard masks, but do you feel like COVID's affected the community or hit community any harder than it has like maybe a corporate, because it's harder to meet with people and talk about their medications, or is it still pretty good over like the phone and maybe Zoom if you use that? But I guess I wouldn't.
Yeah, I mean,
really know.
Yeah, to answer your question, like, so COVID has most definitely changed most things about my residency, I would say.
Okay.
And there was actually came up in a conversation with one of my preceptors, Randy McDonough at Towncrest, and him and I were doing a flu clinic, and I just told him, I was like, gosh, I wouldn't even imagine, what we'd be doing this year with COVID, when I interviewed, like, didn't even know like that was a possibility of what we'd be doing. And some of the things we're doing, we actually are doing on-site COVID testing in the parking lot of the pharmacy. So that is one thing that's changed. Myself and other pharmacists and students are doing COVID testing there. And as far as the vaccination clinics, like there's been protocols that we've had to adjust to, one of which is changing gloves after each patient. So that is something that, is very much different than previous non-COVID years. As far as patient interaction, the pharmacy right now, we are limiting how many people can be in the store at one time. So that does impact, your ability to get face-to-face with people in some regard, but we have very high success reaching out to people over the phone for like the enhanced medication therapy reviews. So we're able to really, capture a lot of those that way, but we haven't used Zoom for anything like that. I think it would be kind of fun to have a video conference or a video, connection option, but it's a little bit harder when you have to make sure you're using a program that's HIPAA compliant, and
Yeah.
Yeah, there are some out there, but there's a cost associated with it too. But yeah, it has definitely changed. COVID
Yeah.
has definitely changed it.
Yeah. I was actually just kind of curious because I guess no one really expected COVID, or at least I sure didn't. So a lot of my rotations are a lot different than what I was expecting. So it's kind of interesting to see that your community residency is as well probably different from what you were expecting.
Most definitely.
I think that's pretty much all the questions I had. Was there anything that you wanted to, I guess, bring up or present or
Yeah,
just advice?
yeah. I mean, I have one question that I have for you here, George.
Yeah.
So as far as like your career goal, if you, I mean, you could even just pretend this is an interview question for you in a residency interview, but like where would you see yourself in 5 years post graduation?
That's a good question. As I've said, I wish I could say I was a much better planner than I currently am, but I would say that I would like to be at a pharmacy, whether a community pharmacy, whether it is currently a independent or a chain one, and I'd like to do a lot more, I would say, with interacting with patients rather than sometimes I know in the corporate setting you just kind of push patients through. I do really want to get to interact with patients and get to know a lot of them, which I know it's probably easier at an independent, but I guess I wouldn't particularly mind if it was at a large chain one. I would just like to do a lot more than just checking for drug interactions and counseling. I do want to get to know the patients. I do want to get to interact. Just I'd rather be that. I'd rather be more than just a pharmacist, if that makes sense.
I 100% agree. Yeah, that's another reason why I did residency was that I did not want to just use the PharmD to be just a dispensing pharmacist. That was the last thing I want to do. So yeah, I mean, it kind of sounds like you see yourself in a role in 5 years in which you have a high level of patient interaction and a high level of
Yeah.
relationship building. So yeah, I mean, I think just talking to you here, I think that residency for you would really be beneficial because you would be practicing at such a high level coming out that it would set you up to be one of the top applicants on the list if you go to the next independent or if you go to even a chain or something like that. If you're trying to be a manager, you would have a lot to talk about in that interview about your experiences that would be much different. Like the examples you just shared, just counseling and doing a drug interaction check. You might not have a ton of stories to speak on about that, but if you had residency experience, you might be able to speak on several different stories where you caught something in a med review or you did something for a patient that you could really tell impacted their life in a positive way.
Yeah. I guess now that you mentioned that kind of, and it brought me back to, or made me think of another question. Do you have like I know a lot of with PGY ones in the hospital, they have the chance to do a PGY two to specialize. Is that a thing in community residency, or do you pretty much only have the 1 year to just kind of, excuse me, uh, learn and specialize in what you want to do?
Yeah, there isn't like a specific PGY2 component for community, but if you're doing an ASHP accredited, PGY1 in community, you can still pursue a PGY2. Now, I can't speak
Okay.
to what that would look like. I mean, if you tried to apply to a cardiology program at somewhere, I mean, you probably aren't going to have the experience that they're looking for to get that position,
Yeah.
but you certainly could pursue something that was actually somewhat on my radar and still is a little bit is a somewhat of a fellowship after this actually
Oh.
with a technology company. I don't know if you heard of Omnicell.
Oh yeah.
That was one, and I mean I'm not certain I'll apply for it or anything, so I have no problem sharing it. But they have some type of fellowship that I feel like they look for PGY ones to apply to it. It's not like a PGY two fellowship; it's just a fellowship. But part of their application, I think, prefers to have someone that has had a PGY one. So there are avenues after your PGY one community where you could do more if you wanted to, continue down that road rather than going into practice directly after.
Okay. And like I said, I think that's all the questions that I have.
So I got.
I guess I'll extend it. Once again, if you have any for me or just in general.
Yeah. I mean, the question I have for you here, George, are you set on doing a residency, or are you still in the process of deciding? Here's we sit November 4th.
I was going to say before this, I want to say I was still thinking about it because I guess I wasn't sure what it all entailed. But after talking to you and seeing what more, because I guess I haven't really I didn't really know what community residency really entailed or the application process. Excuse me again. But after talking to you, I think I've kind of narrowed down what I would like to do. Well, at least try to prepare starting from now on because, again, as you said, the earlier the better. And I know it's cutting it pretty, I know I'm cutting it pretty close in terms of applying, but I do think I do want to try and complete one now.
Yeah. Yeah. So, I mean, I don't think it's too late. Like, I mean, it's not too late until the application is past due. But, as far as those letters of recommendation, that is just, I feel like, the tricky aspect of, you definitely want to give those people ample time to do that. And then coming up to the holidays too, like, and this just came up on a call earlier today with, a residency panel for Iowa, but to make sure your transcripts are requested ahead of time as well. I mean, especially if you're dealing with those deadlines right at the end of the year, your school office that handles those transcripts might be closed over the holidays. They probably are.
Oh.
So if you don't get the request in, like, before December 22nd or whenever they're going to close down, you might be out of luck there. So,
okay, that's good to know as well.
Yeah.
So I have all these notes in the back of my head.
Yeah. No, I mean, I just think to anybody listening out there, if you are undecided about residency, I really think you should pursue it, because I know that I think of what I'd be doing now if I wasn't doing a residency, and I know that it likely would be not in an environment where I can think as openly and where I can really develop towards my next step as quickly. So I think that, to kind of touch on earlier, like I want to start some company. Like, I have interest in a technology startup that is based in healthcare. And I feel like there's value to doing a residency to not only gain a lot of practice experience and credibility, which will give me that power to show the value in a service that I want to provide to people. But at the same time, it allows me to learn from, innovative, forward-thinking pharmacists at this independent pharmacy community level. And that, just kind of, it makes the desire grow and burn more each day. I feel like being in this environment, and I feel like I would be more limited if I wasn't doing a residency.
Okay. Yeah. Well, thank you so much for talking to me. I really appreciated everything. It was really good advice, honestly, and it really did help me kind of streamline my thought process on whether or not I wanted to do a community residency or not. So thank you once again.
Of course, yeah.
Hey, thanks for listening to the show. And if you're interested in kind of learning more, whether you want to work one-on-one with me or you want to just kind of hear more about the residency process, become a student of the residency process, I do have 4 books on getting better at this process. And the first one is the Strong Residency Letter of Intent, Writing to be Interviewed, with a cover letter that earns the invite. And I really recommend listening to the audiobook so you can hear what I'm telling you that you should and shouldn't do with the letter, whether you work one-on-one with me or not. Next, I've worked with Brandon Dyson of TLDR Pharmacy fame, who we worked on a 100 strong residency interview questions, answers, and rationales to really give you an idea of what those questions are that you're going to be asked, and then also a phone interview book that you can get that really helps you understand the difference between digital conversation and a face-to-face conversation. And then finally, once you do get that interview, what are you supposed to do? So I wrote Residency Interview Help in case of interview invitation break glass, because you want to make sure that as soon as that interview hits, you know exactly what to do. And don't get hit by the flash interview where you'll get a call and the interview starts right there. So 4 books, the Strong Residency Letter of Intent, 100 strong residency interview questions, answers, and rationales. Phone interview survival tips, job interview questions and answers for introverts and extroverts, and then residency interview help, what to do as soon as that interview comes. So good luck, and again, hope to hear from you.